Good afternoon and welcome to Webinar Wednesday. We're excited to have over 300 registered attendees for today's webinar, which is eligible for 1 credit from the ACI. Let's get started by giving one lucky attendee a Webinar Wednesday lunch bag for answering this trivia question. How many medals did the USA team win in the Winter Olympics? Answer now using the questions feature on your dashboard. While you're answering, I want to invite everyone to the MD Expo Spring Conference, April 4th to 6th, which will bring HTM professionals from across the nation to Nashville, Tennessee for 3 days of learning, networking, and the latest advances in technology, products, and services. Registration is now open. You can receive complimentary admission by using the VIP pass, Compliments of Nuvolo, found in your Webinar Wednesday workbook. For more information, visit mdexposhow.com/Nashville. Okay, and let's see who the winner of our Webinar Wednesday lunch bag is. It is, let's have a look. It is Richard Campos. Congratulations, Richard. The correct answer is 23. Webinar Wednesday would like to thank our sponsor, Nuvolo. Nuvolo is a modern cloud-based EAM platform that meets the highest standards for ease of use, performance, and online and offline mobility capability for managing clinical equipment for healthcare providers. Visit nuvolo.com for more information. Our presenter today is Ben Pearson, Senior Director of Solution Consulting at Nuvolo. Ben, you may begin whenever you're ready.
Excellent. Thank you very much. And thank you all for joining today. Looking forward to the conversation. And hopefully this is an educational session for you all as we're looking at the landscape of healthcare technology management. So what we're going to discuss today in the agenda is going to be focused on 4 main areas. And the first is around reporting. So when we look at reporting, it's really about making better business decisions. And I'm going to go into a number of areas that we're seeing and trends in the industry. And I speak to hundreds of hospitals, healthcare systems, healthcare service providers over the past few years. And from that, I've seen a lot of similarities across hospitals and organizations in how they're struggling or how they're needing help with making better business decisions and responding to the data that they have with their current CMMS and ways to run their business better or more efficiently. The second is around flexibility and flexibility of a CMMS and some of the challenges that some organizations have been faced with when they're with their current CMMS platform, with things like adapting to business changes, whether those be regulatory changes or others. So I'll talk about a few examples and show you how we address flexibility and how modern CMMS can address flexibility as the changing landscape of organizations happen over the years. So we'll hit on that. The third area is going to be around mobility. And we're going to talk about how driving a simplified technician experience directly relates into resource productivity and how we can actually get a more efficient and also more accurate data at the point of service. And the last area we'll go into is actually looking at a CMMS upgrade and what that might look like with the Nuvolo Clinical Asset Management Platform. So those will be the main areas we'll cover. This will be interactive. So as you ask questions throughout the session today, I will try to field those. And that way that as you have questions in each of these sections as we go through the agenda, I have an opportunity to answer those and address those questions for the audience here today. So without further ado, let's jump right in. So let's first talk about reporting. And let's talk a little bit about what it means to make informed decisions around your data. And some of the challenges that I've seen in talking to hundreds of hospitals and healthcare systems and HTM and clinical engineering, biomed, imaging, and the so forth teams is in a lot of cases, those organizations are having to take that data out of their CMMS system and analyze that data through things like spreadsheets and actually take those spreadsheets and build things like completion and compliance reporting, for example, for their PMs. Looking at capital forecasting or capital planning reports, and the list goes on, right? So one of the challenges is specifically around that, is having to take all this data out of my systems and analyze it, which ultimately is time consuming, right? If you have to respond to a Joint Commission or DNV audit, that takes time, and obviously we want to be able to speed that up and make that easier, is just one simple example. It's also prone to human error. As soon as we take data out of a system, one, it's not real-time data any longer. It's now stale historical data, but it's also prone to data integrity once we pull that out of a CMMS. And then it's difficult to collaborate with that data. So if I need others to look at this data, maybe it's the compliance team, maybe it's your auditing team, maybe it's leadership, your executive team, being able to collaborate with that data can be a challenge as well. Sending spreadsheets around or sharing that data around can be difficult. One other challenge that we see is also driven by a lot of the hospital and healthcare acquisitions that are going on. Most hospitals that I speak with have multiple CMMS systems in place, primarily due to all the acquisitions that are going on. And they haven't gone through a process of consolidating those CMMS systems. That continues to propagate the problem that I don't have a single source of truth across my CMMS platforms. Now again, driving that problem of reporting when I don't have that single source of truth to report against, right? So that's certainly the things that I've seen around the challenges. When we think about the data, is also I want to take that data and engage leadership in that data. That leadership could be level 4 technicians. That leadership could be your supervisors, your managers, the people that are doing PM scheduling or resource scheduling across your teams. Being able to get that data up to the right people at the right level and the right information so that it's easily understandable and viewable is really important. And when I go into a demonstration, I'm actually going to show you briefly some of our dashboards and reports that we have pre-built that are ready to go, ready to be used, and ready to share not only with the folks on the ground, the technicians out in the field, the level 4 technicians that may be doing some of the more advanced work, along with your supervisors and directors and so forth. So we'll do a demonstration on that here in just a minute. So what I'll do next here is actually go in. I want to show some of our reports and give you a brief demonstration on that here. So let's go ahead and let's actually let's look at one other area here. 1 second. So when we think about not only the platform itself and data and reporting, but I also want to make sure that the platform is built and designed around supporting the levels of AMI, right? So you think about there's 3 main levels of AMI. AMI has, the level of fundamental, established, and then advanced. And I need a platform that does these additional things on the left-hand side. So not only reporting and analytics, but also looking at the data around things like cost, being able to track the costs across your locations, across your various cost centers and departments. And those costs can be anywhere from parts. Those parts could be consumables, labor costs, travel costs, overtime costs, are all things that need to be managed and tracked. And that's an item that fits in that advanced category. Also looking at productivity measures. So how do I actually measure my resource productivity across my HTM organization? So actually looking at that from a reporting and analytics perspective and understanding not only how many resources do I need today, but also looking out in the future with how many resources do I need for my upcoming PMs, right? How many resources do I need as the business grows, as we add locations or acquire additional sites? All things to think about when we look at resource productivity. Also looking at how does an HTM programs platform have analytics, right? How can I actually run analytics and do additional data crunching against the information that I have in the platform? Being able to understand trends in terms of medical device adds or removes, understanding where my equipment is physically located at or changes to my equipment. So obviously doing analytics against it as well is very important. And then we think about integration capabilities, and we'll go into this a little bit further later, but also tying in with other systems within the organization. And why does this matter? Integrations for us matter because it's really about driving process efficiency and not having to go to multiple systems to make business decisions. So a couple examples I have here, and we'll talk more about them in a second, is tying in with your RFID or RTLS system, right? Being able to actually know where is my equipment as it moves around the hospital. Being able to have that data all within my same CMMS system so I can actually see graphically as well as digitally where is this device on an actual floor plan. And then tying in with financial systems and others, and I'll talk more about that in a second. The next 2 areas, asset reliability measures. So how reliable is my equipment within the environment? A couple examples might be cost of service ratios, understanding do I repair, do I replace the device? So tracking that data, when we talked about those cost related tracking on the first bullet, that ties directly into understanding what is my cost of service ratio across my medical devices. And now when I'm doing a repair, understanding should I replace this part or not? And based on that part repair, is that a decision, maybe I should replace this component or replace this entire system because the cost of service ratio is now hit the threshold. It's going to cost me as much to repair it as it is to replace it. Other areas might be mean time between failure. Understanding where is my mean time between failure across my fleet of assets, even leveraging mean time between failure to do things like risk scoring and adjust my risk associated with a device for my heavier failing devices within my organization. Last area is self-service. So how do I drive more self-service so that my nurses, my staff aren't picking up the phone and calling a primary technician or secondary technician? They're actually using self-service and reporting what their problem is via self-service so that it auto routes to the appropriate technician that actually needs to get this work, whether it be a clinical device, whether it be a laboratory device, or any other device that needs support within the hospital system. So those are the key areas when we think about kind of that goal of getting to an advanced level, but having a CMMS platform, a modern platform that supports those requirements of being at that advanced level. So how does real-time reporting help? So the goal here is not only having out-of-the-box reports that the HTM and clinical engineering teams can leverage, as part of each of their roles within an organization, but also be able to build your own reports through self-service reporting, not having to call a vendor to do reporting and analytics across your data. It's really important so that you can quickly make business decisions on the information. What I'm going to do here briefly is just flip over and show you a couple examples of reporting in the platform and how this can be done. So if you look here, I have three main areas that we focus on as part of what I just talked about, whether it be operations. So how do I run my operations within an organization? How do I manage my financials across my organization? And how do we manage compliance across the organization to be able to respond to environment of care reporting, be able to respond to DNV or Joint Commission audits within the organization. So having that data at my fingertips, and this data is real time. So I literally can look at this data, looking at repairs, equipment downtime, availability, resource scheduling, work orders completed by technician, and this is all live. I can click into any one of these data points and actually see the work that's actually been completed by my technicians in the field. So again, live, actionable data. Sorry, was there a question?
Yes, Ben, I have got a question. How does this system work for service vendors that work across multiple customers, many different systems?
Yeah, great question. We have service providers that are using this platform. Some of the large OEMs of manufacturing medical devices also have services businesses that are using this. So what they do is they actually manage, and it's actually segmented customer by customer, same platform, but we're able to segment the platform so that I can actually report customer by customer, not just as if I'm a provider or a hospital. We support both use cases, and we support things like contracts as well. So contracts across each of your customers and each of your vendors. So if you're a GE or a Siemens or one of the large service providers across the organization, Sodexo's and others, I can actually manage my contracts. I can manage the assets associated with the customer that I'm supporting, and I can manage my productivity, my financials, and my compliance customer by customer as a service provider as well, if that answers the question. Okay, great. So that's some operational report examples. Financial reporting is important as well, right? So tracking my costs, and again, the goal here is not to add more work to my HTM technicians. The goal is that that's getting captured automatically as work's being performed. So as work is being performed as under contract, if it's a maintenance contract, as work's being performed, automatically tracking the cost and being able to roll those costs back to your contract to understand a return on investment of the contract you made. We just mentioned service providers, a question that just came in. Being able to actually look at my vendor service contracts that I may be paying to a third party, and vice versa if you're a service provider, being able to measure that customer by customer as well with the contracts and the revenue you're trying to achieve on those particular contracts back to a customer. Things like capital forecasting, being able to know when am I needing to spend money, when should I be replacing the equipment within my environment, is another area that leadership likes to look at, because I don't want to be surprised that we have to buy a bunch of imaging devices this year, multi-million-dollar expense. I want to know when that's upcoming, forecast that spend, and be able to budget accordingly for that. So lots of other areas. Cost of service ratio tracking, assets by assets, asset type by asset type. So you can start forecasting that as well, replacing based on repair versus replace decisions. So lots of other reports. We have over 100 reports out of the box. I'll hit on compliance last to kind of close out the reporting conversation. But tracking environment of care, being able to understand where do I have problems. Again, this is live data, and I can send this into a report format that an auditor could review and look at, right? So looking at AEM equipment, what devices are falling under an alternative equipment maintenance formula and why, right? Being able to show Joint Commission the documentation behind that AEM formula to understand justifying why those systems fell under that. PM tracking, so PM completed this month versus compliance. So, right, obviously completion is one thing. What work did we actually get done this month against the PMs that were due? And then actually ones that did get completed or not completed, were they compliant or not and completed on time or not? Or were they not, were they in use? Could I not get access to the room or not found? So just a few example reports. Again, this is out of the box, and this is being tracked as part of your work order process. So just want to give a quick look at that. We'll come back and do a little bit more demos here in a minute, but I just want to give you a sample of how real-time reporting. Again, I didn't have to take any of that data out of my CMMS to be able to now put it into a live actionable dashboard, which by the way can be shared all the way up to your executive team or all the way down to your technicians in the field that need to see the data that's relevant to them. Great. So let's look at the next slide. Now we're going to talk a little bit about adapting to business change and flexibility of a CMMS. This is pretty consistent of a challenge that I hear. We need to be able to have a CMMS system as healthcare organizations or service providers that can flex to those changing business needs. And those changes could be regulatory changes. It could be acquisitions that now require me to modify the fields that I have, the reports that I have, the data that I track. It needs to be able to change quickly and adjust. And you shouldn't have to call a vendor to get those kind of things changed. You should be able to do that yourselves. That's the key there. And if you look at some examples, Joint Commission, you heard at Amy last year, they mandated, for example, tracking all of your maintenance manuals and have it be able to show the service manuals that you're using as part of performing maintenance. Being able to quickly adjust year over year, month over month, as Joint Commission or DNV says, hey, here's a new regulation, here's a new area that you need to track as part of your CMMS, you should be able to react and do that in near real time, same day, next day. It shouldn't take months or longer or have to pay to do that. Maybe state regulations change that require adjustments in your reporting in terms of what you're tracking and how you're tracking it. FDA changes and regulations and so forth. These are just a few examples. Even business changes, as your own business changes, requiring you to track or manage your environment differently, you need to be able to quickly adjust to that. And I'll talk about that when we go into the demonstration on what a modern platform should allow you to do yourself versus what you may be struggling with today with your current CMMS. Other areas would be simplifying workflows with integrations. A lot of times what we hear and what I see personally is the CMMS system is sort of standalone. It's not tied in with other applications and systems that it really needs to talk to be able to simplify and streamline the process of working with. I'll give you a few examples. So if I'm a technician in the field and I need to order parts or services, in most cases when I talk to a hospital, they're actually swiveling, they're actually going into their ERP, whether it be Oracle or SAP or Lawson being the most common in healthcare, and actually now putting a purchase order in that system and then having to go back and forth from CMMS to Lawson or their ERP to make sure that the data is up to date. When did I actually order it? Did it actually get received? Then go through a receiving process to now add that part into my work order or apply that part back to my parts inventory. That's not very efficient. That's just one example. Another example would be safety and recalls. Being able to automate tying into systems like ECRI or RASMAS or other alerting systems, maybe the FDA, that now allow you to automate when a recall comes out, matching that recall to the devices within your inventory and automating the work order creation to track that entire life cycle in an automated fashion of recall comes out, devices are identified, and now it's remediated, be able to show that to a compliance officer, et cetera. It's really important. Be able to also tie in with classification systems. So the FDA has UDI, for example, Being able to classify your devices to UDI. You could also classify to ECRI's UMDNS, Unique Medical Device Naming Standard. So having that data automatically brought in to help you automate and standardize on your data management of manufacturers, models, asset types, and actually have a standard classification system. These are all things that are possible with a modern platform that allows for that direct integration and bidirectional passing of information between these critical systems, so that now as technicians and even leadership, you're operating in one single platform and not having to work through multiple systems to get information and ultimately do your jobs. So I'm not sure if there's any questions that have come in through that. I can pause for a second if there are. Okay, great. The last slide I'll talk about is coding versus visual editing. And what we mean by coding is truly writing code, right? You're actually programming in a system, which is a bit of a thing of the past when you think about these modern CMMS platforms today. And I'll give you some examples of that. I'll actually show you what it should look like versus what you may be struggling with today. One question I would ask is, do you need to contact IT, or do you need to contact your system administrator of your current CMMS to make changes? Or is this something that you can do yourselves or do with I'll call it a clinical admin within your organization, so that now you don't have to wait and takes time and money to actually get these simple things changed. And I'll give you a few examples when we go in and do the demonstration. So let's actually jump into the demo here. I'll show that briefly in terms of configurability and visual editing and what does that really mean. So let's take a look at that for a second. So what I'm going to do is actually bring up an asset record. I'm sorry, was there a question?
Yes, I'm sorry to interrupt you, Ben. I've got two questions. The first one is, does it integrate with accounting systems software like Microsoft Dynamics Great Plains? Yeah. So Dynamics Great Plains, it's one of the less frequent used ERPs we see, but yes, absolutely. We've integrated with Microsoft Dynamics ERP system, SAP, Oracle, Lawson, the whole gamut. Yeah, so typically parts ordering, also tracking asset acquisition cost, depreciation of your assets, or a couple other data points that we will typically pull from a Microsoft Dynamics ERP or any ERP for that matter. Okay, that's great. And then another question is, how do you link devices to UDI?
Sure, yeah, absolutely. So there's actually so the way we do it is actually as part of your onboarding process. So as you probably know, every device sold now in the US is affixated with a UDI barcode, right? So it's a long string barcode that's on every box of medical device you order. The way we do it is when that box shows up at the dock at one of your locations, you're actually using our app, scanning the UDI barcode as part of the onboarding process of that medical device. That's actually going to pre-populate things like asset manufacturer, model. It's going to tie it back to the FDA's UDI as well, so that if there ever is a recall, for example, or you want to look at this device based on its UDI, you now can automate that. And as part of our platform, we actually pull in on a daily basis all of the FDA's UDIs. And if you have an ECRI subscription, we can also pull in all of your UMDNS classifications as well. So you have the option of classifying to the FDA's UDI. Now, the challenge with the FDA to UDI is they don't have all the old assets. You probably have assets in your environment 15, 20 plus years old. Well, the FDA didn't start mandating all assets have a UDI barcode until fairly recently. So there is still the challenge of the legacy devices within your environment, and that's where we need to look at other classification systems to be able to classify your legacy systems. But the good thing is going forward, you scan a barcode, UDI barcode on a new asset. When you onboard it, it auto classifies its manufacturer, its model, and all the details associated with it as part of your onboarding process. Okay, any other questions? Great, awesome. Good questions, I like those. All right, so I'm just gonna briefly take you out. We're gonna show configurability. I brought up a simple asset record here where I'm actually gonna look at this, and what we have the ability to do as an admin. So if I'm a clinical admin that administers the application, I have this ability to right click on a record. This record could be a work order record, it could be an asset record, it could be a part record, and I can configure and look at a form designer. I've actually got it preloaded up here so you can actually look at it. So that asset record you were just looking at here, when I bring up the form designer, I can actually look at all the fields within here I can visually modify this field. I can bring in additional fields. So if I want my AEM formula all of a sudden to be in here as well, if I want to move where the barcode's at, I can actually modify the look and feel of this through drag and drop, just like this. And once I hit save, this automatically is going to update my platform within seconds. So you don't have to call a vendor to modify the look and feel of the platform. You know, you can do all of this yourself as an administrator of the platform. Again, this is just simple form-based modification. And there's a lot of other visual editors as well, including our workflow editor. So I'm going to quickly show our graphical workflow editor. So if you have things like, well, a lot of hospitals, I mean, most healthcare organizations, you've got a decommissioning process or an asset onboarding process of commissioning an asset within your environment, which requires approvals, which requires certain tasks to be cut to different various groups. You can visually lay out your entire business process for how you decommission an asset and the steps that you go through. So now when a decommission is triggered, it actually follows a consistent business process. And by the way, I have a visual representation now of your business process that I can go back to saying, what is your standard decommissioning process? Here it is. Here's exactly how it operates. So incredibly powerful. It is visual, and you can drag and drop and adjust approvals, adjust various states, follow different workflows based on each step that you want to follow. But again, it's visual. It's not coding, right? This is all graphical. And if I want to bring in additional steps, I can do all of that right visually and drag and drop these items directly into my platform without actually, you know, if-then statements, condition statements, so forth, all through a visual editor. So that's what we mean when we say visual editing versus coding. I'll pause if there are any questions on that. Okay, great. Great. Feel free to jump in if there are. So the next area I'm going to touch on is mobility. And I've been in a couple hospitals over the last couple of weeks, and this has been a challenge for them, where they've got, I'll call it a legacy CMMS system, and it has a mobile app, but the challenge with it is it's not working. Either it's not performing, and they end up having their mobile devices in the desk drawers of their offices. So they're actually not utilizing it, right? So.
Sorry, Ben. Sorry to interrupt you, but I've got a quick question. Can you free type in these fields and change the labels of the form design fields?
Great question. I love questions like that. Sure, absolutely. So if I want to change, I'll give you a live example. So maybe I want to change hazardous to be something different. I probably wouldn't do that, but I can literally configure the label on this through a right click. So instead of hazardous, we'll call it something else. We can call it maybe just hazard. Sure, update it. So on the fly, I just changed the label on that. Let me go back to that field 1 second. Sorry, jumped out. 1 second. Let me go back there. So if I look at that device again, let me just grab my device inventory 1 second. And by the way, that applies across all my devices that I just changed. So if I bring up an asset, you'll notice it's no longer hazardous, it's now hazard. So I have the ability to just right click and configure a label right here. I can also configure if it's a mandatory field or not, or if it's read-only or not, all through right click. I don't have to do any, you notice that was all just configuration. So I don't have to do that, very simple. If I want to add a field, again, very simply, I can right click and I can look at the designer. I could also do a layout view. So a lot of different options on quick configuration, simple examples there. If I want to create new fields and I want to give it its own name and string, I can do it that way right here. So this would be a new field. And the power here is, you'll notice I can add choice list fields if I want multiple choices, if I want a date and time field. All right, the list goes on and on. String text fields, true, false, pass, fail fields. So very powerful. You'll see how fast I can create new fields and edit forms. I can do that across my platform. So if Joint Commission says you now need to track alarms associated with your medical devices, you add a choice. This is a yes, no field right here. I now can track it right there within a matter of seconds. So hopefully that answered that question. Okay, great questions. All right, so jumping back, mobile adoption. So I want to spend a minute on mobile because, you know, for me, why do I want to use a mobile platform in general as a technician? Ultimately, it has to be easy to use and it has to just work, right? This has to be easier than going back to my laptop or desktop and rekeying in. I mean, I see printed work orders still being used in the clinical space for the hospitals I talk to. I see folks that are waiting until the end of the day to update their work orders. I see different use cases, but ultimately I've got to make a technician's experience more efficient, more effective. And as a leader or as a clinical director or manager, I also want to know information throughout the day. I don't want to wait till the end of the day to know how are we doing on our PMs that are open that are needing to be completed. If I can get that data from a technician at point of service, so when they complete PMs throughout the day, I know in real time what's actually happening within my environment. That's what I want as a leader or a supervisor. And as a technician, I actually want to be able to go home at the end of my day and not have to rekey in and enter all my work order data when I'm done actually at the end of my shift. So again, I think there's going to be a poll question, if I'm correct, where I think we're going to go ahead and put a survey up there. Is that correct?
Not that I'm aware of.
All right, sounds good. No problem. No worries. We'll continue. No problem. So when we think about mobility, right? So how easy is it for mobile to work within my tech's environment? How can I get my technicians? And when I think about mobile, it's more than just the technology. It's also about making sure that I can continue to hire technicians, clinical engineers right out of college, universities, because getting and acquiring talent is also a challenge that I hear at hospitals. And being able to put a mobile device in a technician's hand is important to some of our healthcare organizations that we're talking to. And they see that as the future for clinical engineers in the field, is using a mobile interface. You have to balance, the thing we think about is it has to be a balance between that technician experience and the information that management needs. So that's what we see, that sort of pull between each of those areas, and striking the right balance of capturing the right information or automating the capture of that information, again, to simplify the technician experience while still giving a leadership the information. For example, how long is it taking to repair the device? How long was that device down, so I can track mean time between failure? And the list goes on, right? So that's really important. One of the other areas we see is we want to make sure that as part of selecting a new CMMS is making sure that you're getting technician buy-in. Sometimes we see healthcare organizations that are making a CMMS decision at the leadership level only. One of the things I highly encourage is bringing your technicians to the table as part of that process. I did a workshop just this week actually at a hospital where they brought in 50 technicians to actually put their hands on the mobile device and try it in the browser, make sure that it's working and that they understand what is that experience going to look like going forward. Because when you think about moving to a modern platform, a big part of that change and opportunity is also organizational change management. And also getting feedback from technicians on what's working and what's not is a critical, important step. So I do encourage you to try before you buy and make sure that the technicians understand, what is the new platform going to look like. One other area that I'll hit on is also, as I mentioned earlier, it has to work, right? So not only does that have to be easy to use, but it has to always work. A lot of mobile solutions that we see today are online only, meaning I have to have a connection to my network, or I have to VPN into my network, or I have to, have a cellular connection to my network. Otherwise, if a tech goes out and they go to an area that's not connected, we definitely see this in the field service use cases where you have technicians that get in their vehicles, drive to urgent care or clinics that don't have dedicated HTM techs. And in a lot of those cases, a printed work order or a laptop may be the case or the path that they go down instead of being able to use a mobile device. So you really need a solution that can work both online and synchronize and work offline. So there's no scenario that a technician can't actually update work orders, add inventory, right? Change states on assets or update asset information, work your PMs, et cetera, so that when you regain connectivity, it's going to synchronize back and be updated with the dates and timestamps of when the work was performed. So again, that's the key there, is a mobile interface has to work in any condition. And I'll give you a demonstration of that here in just a second. So let's actually look at a modern mobile platform and how that might look a little bit different than maybe what you're using today. So you're looking at my iPad here, and I can actually scroll through my dashboard. This is a sample clinical dashboard of what a technician might see for things like their assets and their asset inventory, their work orders, their PMs that they've got to work on, their group's corrective maintenances that have come in, maybe their own work orders that have been assigned to them by their supervisor or their team lead, and be able to quickly look at reports and dashboards associated with this as well. From here now, they can actually toggle and look at other things like their asset data, maybe create a new work order or look at their work orders or other areas. And one thing to note is this platform works online and offline. So if I was to lose connectivity, right now you'll notice at the blue bar at the top, I'm connected. But if I lost connectivity or I had to went into airplane mode right now, it would continue to operate. I could continue to work. And the synchronization is happening at the bottom where I'm actually tracking what's synchronized down locally. And only the work that I need to do is synchronized. So if I want to go in, let's take a look at a couple things I want to show. So let's look at asset inventory first. And some other advantages in getting mobile in their hands is I can do things like barcode scanning. Maybe I actually want to scan a barcode to find out what asset I'm at. We see this a lot with things like inspection work orders, especially when you're doing a lot of inspections across a lot of devices where you need a bulk scan, making sure that you have the right device in that you're actually physically working on. So I can just demonstrate that briefly here and show a barcode scan here briefly and how that actually operates. So you'll notice I quickly can scan a barcode. And keep in mind, this supports, if you've already barcoded your assets, we automatically support your current barcodes, 1D, 2D, and QR codes. We also support RFID. So those are the most common barcodes within a hospital. And then from here now I can look at inventory and so forth.
Okay,
maybe I want to work on, yeah, go ahead.
Sorry, I have a question. Can
Absolutely.
A photo of the piece of equipment be uploaded so that when you bring it up and as an asset, you can see what it is?
Yeah, a couple different options. So we have this attachments option, so I can actually bring an asset up. I can actually look at a photo. So let's actually, I'll take a photo here for you for the sake of the comment here. So maybe I want to take a picture of the photo of the device. I'll take a picture of my laptop here for the sake of everybody on the remote. And we'll add that to my asset record, work order record. So now I've got the photo. By the way, this photo is now available back on the browser version. I can actually look at a photo of the asset as well. I can store this as part of my inventory information. So yeah, absolutely, great question. We absolutely support taking photos, capturing photos. Maybe a device is damaged in the field, or maybe I want to take a picture of a particular component like a board and show where am I actually working on it, and actually have that for reference as well if I'm collaborating with other technicians, for example. So yeah, any other questions? I'll pause for a second. Were there any other questions on that? Okay, great. While I'm here on the screen, I can also capture an electronic signature as well. So if you need a third party, or if it is a third party, if you're a service provider and you need to have the hospital sign off on work, you can actually leverage our electronic signature capabilities to capture that electronic signature. You can upload and download files. So if I want to attach files to this work order or this asset, I can do that as well. So let me show a couple other quick things here while I'm in on this particular item. Other areas, let me actually stop my time on this here. I want to show you a couple other things. We also include a start-stop timer. And why we included this was to be able to simplify data entry for technicians so that they don't have to manually say, here's how long I spent working on this. When they start working, they hit the start button. If they have to pause their time, they hit the stop. They enter what they did. They can restart it and go again. Or once they're finally completed, they can hit stop and they can mention if this is billable or not. They can add their work notes, and they can even use things like voice recognition, right? So we don't just use keyboard. If somebody wants to use voice, they can do that as well. Completed the repair, right? So you can leverage those kind of capabilities as well. And it's going to automatically add your work order cost right into the work order. You don't have to do that separately. A couple other things I'll mention while we're here. Procedure checklist. Oh, sorry, there's a question.
Ben, sorry, sorry to interrupt you. I've just got one quick question. It says, can dashboards be set the same way globally for all users, or is it set per user?
So it is roles based. So I can define a standard technician dashboard globally if you'd like, but I also can define a roles based dashboard as well. So your imaging department may want to see one thing. Your biomeds may want to see something else. So it can be roles based. If you want a global standard, it can be set as a global standard. If you'd prefer it to be more role by role, we can also configure it for each of your roles within the organization. Both are available. It's a business decision.
Okay, just another quick question. When a work order is closed, could you provide a reminder to the technician to add their test equipment and completed their work order tasks?
Mm-hmm. Yeah, absolutely. So we can require that if they're using a fluke meter, for example, which we do, by the way, have an integration with. So if they're wanting to capture their fluke meter results, it's actually a good lead in. So as part of our checklist right here, right now you'll see yes, no, pass, fail options here. We also can capture a value. So we can actually capture test meter results within our checklist, and from there automate a failure. So if we have an upper limit, lower limit, acceptable range, we can actually, if it's outside of that range, auto create a corrective maintenance work order on a failure of calibration or of one of these checklist items as well. So you're not just working off a PDF process manual. You can actually turn those into electronic checklists. Again, yes, no, pass, fail, or fill in a value, calibration value, numerical value, or free text. Yeah, hopefully that answered that question. And yes, we can automate before a work order is closed. Certain items must be filled in. Checklists must be completed. Additional data points must be tracked as well. We can require that as part of the business logic. Absolutely. Great. Okay. Any other questions I can pause then? Yep.
Yep. Where can you view that photo and share that with your customer?
Sure. The photo itself is uploaded either to the asset or the work order. So if you want to share it, you can actually go into the work order itself. So let me actually do that. Let me submit these checklists and I'll show these real quick. We'll do our checks here. And let's synchronize that really quick. Let's submit. Let's go back here. So where you're going to see that is back in the browser version. You actually will have that attached to the particular work order itself. So you could by the way, I also could have gone into that work order or the asset, downloaded that attachment or that photo, and I could email it from here as well. There's multiple ways you could actually distribute that photo, or if the customer put that work order in via self-service. So let's talk about that for just a second, since the question came in. I assume that may have come in from a service provider, since it sounds like a service provider related question. So what you're talking about specifically is, let's say a customer reported a problem. Actually, let me jump into that briefly here just to answer that thoroughly. So let's say a customer came in and reported the problem through a self-service portal. So as part of our solution, we do have a self-service portal as well. And let me go and bring that open here. So as part of the self-service portal, if they reported a work order, so let's say they actually reported a particular work order as part of their clinical reporting, when they actually look at that work order that was reported via self-service, they could see, I'm going to bring one open. I don't know if this one has an attachment on it. I could attach one and show it to you. We can actually expose to them that attachment right here. I could actually show that attachment out externally to that end user that reported the problem. That end user could be an internal staff member in a hospital, but that also could be your end customer if you're a service provider having access to that particular attachment as well. That's where this would show up. Yeah, hopefully that answered the question.
Okay, just one more. Does the mobile version have RFID capability?
It does. So it does support RFID. We use Bluetooth attached RFID devices, since iPhones, iPads, Android, Windows devices don't have RFID natively on them. We support Bluetooth attached RFID scanners. And the big RFID vendors that we've worked with is Centrax, Stanley Aeroscout, Impinj, Ekahau. They all have a fairly similar architecture in how they actually provide us the data with a centralized server that stores at the last known location of the medical devices that moves around the hospital, or the bed that moves around the hospital. And then we can report back the last known location of the asset. Yeah. And just to give you one last visual while you're talking about that, I can also bring up that asset's last known location. So I'm looking at an asset record now, right here on the screen. Let me move my iPad out of the way, apologies. So on this asset, I'm actually updating the location of the asset based on where our TLS or RFID is reporting its location. So that's where that interface or integration comes in. And then I can actually bring up the floor plan for that asset. Where is it actually at on the floor? We can actually show that visually and have it actually give you a visual representation of where is that particular asset. Let me slide this out of the way, apologies. There we go. So it looks like this one is right here on this floor of this hospital. So, so that's how we'll tie in with an RFID system as well. So that one's right there in that room. Hopefully that answered that question. Okay, great. Good questions so far. I like those. I think I hit on most of the mobile areas that I wanted to cover today. If you have other questions, certainly let me know. I can do purchase order requests from here as well. I can look at if it's under contract, I can look at the contract. If it's under warranty, I can see that as well. So there's a lot of other areas that we've exposed on mobile, and more can be also added if needed for things like other particular transfer order requests, etc. So hopefully that helped. But again, very flexible platform. Again, online and offline. So there's no condition that this won't work in. Obviously, I'm synchronizing my data. Once that's local, I can go off and do that work anywhere, anytime. Okay, what I'll do next here, let's just go ahead and bring the presentation back up. Turn that off. All right. So a couple things let's talk about now is, how can Nuvolo help? So one of the things that we want you to think about is, if you have an upcoming CMMS project where you're considering alternative CMMS solutions, or maybe you're looking to do a CMMS consolidation across your organization because you're buying other hospitals, they have other CMMS systems. So you're thinking, how do I deal with all these other CMMS platforms in my environment? Certainly looking at a modern platform that, by the way, helps you streamline that migration and consolidation effort is something we absolutely can help with. And we've walked into hospitals and literally taken 20, 30 CMMS systems out of an environment because of all the acquisitions they've done and brought them into a single system, normalizing their data, for example, to industry standards like ECRI's UMDNS or the FDA's UDI and other areas of trying to drive standards across the hospital or healthcare system, or even service providers. So if you're interested in the benefits, certainly, looking at a couple examples here. So one of our customers, since we do have a service provider on the call, one of our big service providers that leverages our Nuvolo platform is GE Healthcare. They're one of many. They leverage our platform globally to manage their customers' medical devices. And again, they're leveraging the entire portfolio of solutions. You saw reporting and analytics, you saw mobile, and again, the configurability allowed us to support a customer the size and scale of GE. So one thing we do every week is we actually do live demonstrations going much deeper than what I did today into our clinical platform. And you'll see here in yellow the link at the bottom where you can actually go out, register for our weekly demonstration, see our solution, and allows you to actually get a bit of a view and demonstration of our overall capabilities deeper than what I did today. So at this point, what I'd like to do is, I appreciate, by the way, the live interaction between everybody on the phone today. If there's anything else I can answer with the time remaining, I'd love to. So if, I'll go ahead and open up the floor and see if there's any questions.
Okay, yes, we've got quite a few questions. How does a system manage purchase orders for parts and associated reporting?
Mm-hmm. Sure. So the way it works is I can initiate a purchase order. Think of it as a purchase order request, right? It's not the actual PO. Your actual PO is going to reside within your ERP system, whether it be Great Plains or Lawson or Oracle or SAP, depending on what ERP you're using. What it does is it initiates it within the CMMS system. So I'm actually making that request. I'm specifying my shipment. I'm specifying where I want it shipped to, my stock room that I want it to go to, the particular part that they're wanting. Keep in mind, we also interface with other part systems like PartSource and others. So we do have the ability to tie in with other parts ordering systems. And then what we do is we integrate with your ERP. That request goes over to your purchasing module within your ERP system. That follows its procedure, whether it be approvals or steps that are required to actually make that order, make that financial commitment, actually purchase the part. And then what we do within our system is actually go through a receiving process. And you can actually receive it as a technician and choose, do I want to receive this part back to the work order that I'm working on? Or do I want to receive parts back to my stock room or my trunk stock if I'm going to retain these myself? So you have multiple options as part of your receiving process, and you track it through that whole life cycle. The good thing is that you don't have to go to your separate ERP to do all that work. You actually manage and track and maintain that full life cycle actually within your CMMS system. Hopefully that answered that question.
Okay, thank you. And how do you report on device recalls and compliance to the recall process?
Sure. So our safety and recall process, one, if you've already subscribed to a safety and recall system like ECRI or RASMAS, we actually build an interface right to it. We have a native integration to those two systems. So we leverage your subscription to ECRI and RASMAS. When that alert comes out, we're actually capturing the alert and the details of the alert so that we can actually look at, for example, here's the UMDNSs that are affected. Here's the particular serial numbers that are affected. And we are able to auto-classify and actually identify the devices that match the alert to be able to show those devices that actually match. And I can actually give you a quick demonstration of that while we're talking about it. So within Clinical Asset Management module here on the left, I'm actually going to go down into our safety and recall section. And I can actually see safety and recalls that have come in. Looks like I've got one example here. This one came in through ECRI. This alert auto-classified this device based on a manufacturer, a model, could be serial numbers as well. It auto-classified based on the matches, the assets that are impacted, and then it auto-created work orders against that particular set of devices. Now you can automate that or you can make that manual depending on your process or the criticality of the alert. And then now you're tracking it, think of it as a mini project. I, as a compliance officer, can see the alert, who owns the alert, and then ultimately the assets impacted and the related work orders associated with it as well. Hopefully that answered the question.
Okay, another question that came in. To interface with ERP systems and make changes, do we still have to connect with Nuvolo?
Not sure. So the answer is no. Could you interface your current CMMS to an ERP? Most likely you probably could. In a lot of cases it's difficult because a lot of the, call it legacy CMMS systems, don't have what's called an open API, meaning I can interface with any field within the application. So any data field in the application is not open for a web integration, for example. So it can be difficult. The answer is, could you do it with your current CMS? Yeah, you absolutely could. It would just be difficult to, one, do it initially, and two, maintain that ongoing. So just something to think about. Our platform is completely open API. What that means is every single field in the system, even ones you create, automatically are turned on for web integration. So now I can interface that directly to an ERP system in a fairly short order. So hopefully that answered the question. I think that's where that was going. Okay, and
how do you track end of life for equipment?
Sure. Yeah, so we track it a couple different ways. We do, so end of life in most cases, especially medical equipment. Facilities equipment's a little bit different, but medical devices are going to go well past the depreciated life of an asset. We do track depreciation. So that's one area we look at, is the depreciation of the asset. The second is going to be manufacturer's recommended end of life. Most organizations, though, don't just track manufacturer's recommended end of life. They may have also their own useful life tracking as well. We actually track that at a model level, which cascades down to the assets that match that model. So we define manufacturer's end of life. You may have your own useful recommended end of life that you've adjusted from manufacturer's date. We can leverage either of those two dates to plan for replacement of assets. The last is looking at cost of service ratios. So you may look at the end of life date, but the cost of service ratio may be driving up so high that you may say this needs to be replaced sooner than waiting for the end of life of the asset itself. So that's, in a nutshell, it's not just one answer. There's multiple ways that we look at when we think about capital planning and forecasting when making those kind of decisions, but those are the main areas that we see hospitals looking at.
Okay, that's great. We've got time for about one more question, and it's, does the work order / service event distinguish a high risk versus a non-high risk?
Yeah, absolutely. So the state of our work orders is what drives that. We can actually drive priority of work based on a number of conditions. So an asset type, an asset, a location can drive the priority or the criticality of that piece of work. And so, yeah, so our work order system does have the concept of a priority. We can also wrap a service level agreement around it as well, especially service providers are going to do this. You're actually going to set up service level agreements in terms of availability, uptime, downtime associated with that work. And based on the equipment, typically modality, you're going to be setting some level of service level agreement associated with that, or maybe it's back to the cost center of the department as well. We see that as well. Yeah.
Okay, that's great. Well, that's about all the time we've got for today. So thank you so much, Ben, for a great webinar. And obviously, thank you again to today's sponsors, Nuvolo. I'd just like to remind attendees, any questions we didn't get time for, we will be sending them to Ben, so he will reply to you. So one lucky attendee will win an Amazon gift card for completing the post-webinar survey. Details will appear on your screen shortly. Now, you must complete the survey to obtain your certificate of attendance. If you do not see the survey, please email us at webinar@mdpublishing.com. For more information about our upcoming webinars, please visit our website, webinarwednesday.live. Thank you once again, and hope you have a great day, and see you next week.
Thank you all very much. Appreciate it.